IMPaCT was commissioned as there was real recognition that although there is a myriad of health and care and support services across Liverpool and Sefton, there was a gap in terms of those services working collaboratively together. A number of organisations got together, including Mersey, Luft, Marie Curie and Woodlands, in order to make a difference for people's lives and in order for us to deliver the right care at the right time, first time, every time.
So the main purpose of IMPaCT is to allow and enable a group of highly skilled healthcare professionals from different organisations to come together and deliver the best possible care for patients living with a terminal illness. I think what it does is it gives them the reassurance that there's somebody there to give them advice and support 24 hours a day, 7 days a week. What it's prevented is a lot of the duplication that we used to get, and it also means that we don't get a problem that we used to see, which was sometimes people falling through the net and not getting the support that they needed.
For us, IMPaCT provides a single point of contact and referral for our patients, and this is brilliant because when we phone the IMPaCT service, we know that we're going to get some specialist palliative care advice and a whole team who can wrap around the patient and provide support needs to them.
For patients to have access to the right people with the right knowledge and skills at the time that they need is really beneficial for patients. It gives them time back to do the things that they want to do, to be with the people they want to be with. That might be the family, but it might be that they want to go and have a day off to the beach. And we're trying to enable that through IMPaCT, manage their symptoms, manage their needs, give them the quality of life, and keep them as fit and well as we can do for as long as we can do so that they can enjoy what little time they've got left.
As a consultant working in palliative care, this is a consultant-led service, and it's really important, therefore, that we have that overall awareness of what patients are out there under the umbrella of all of our services. And I feel I have a much clearer idea of who's out there and what we're doing as a collective service. That gives me the assurance that we're getting to the right patients when we need it, and that our services are being used appropriately.
IMPaCT has made my job easier and also more rewarding in lots of ways. I now get a real sense that I'm part of a much bigger healthcare environment. I've got easy access to colleagues in other healthcare settings. And it really just smooths that patient pathway across all organisations.
It's allowed us to communicate better with other teams, other palliative care services, and also GPs and district nurses. And I think having those links and relationships with other kind of professionals means that it's easier to get patients the help they need more quickly and to make sure that they're seen by the right service and there's less delay making that happen.
Patients and family members were consulted in several workshops over the years to find out what they wanted the service to be. Patient advocacy and finding out what family carers require is really important, because how can you do perfect care for a patient if you don't know what the patient wants within that? Because I've heard and seen enough of other people who didn't have the death they wanted because they weren't where they wanted to be and they didn't have around them the people they wanted.
What patients want is to have a service that knows all about them and understands their care needs, and I have had feedback from patients that when they contact the IMPaCT service, that is exactly what happens. They speak to somebody that knows their history, knows all their healthcare professional contacts, and is able to support them and make some decisions about their care very, very quickly with them. They have greater confidence that there is a joined up system supporting their palliative care rather than it being divided between a hospital, a hospice, community teams and GPs. They do feel that a system is properly coordinating their care.
And it's made a big difference. We found that for those people that want care outside of hospital, we're able to provide that. So whereas before 9% of people would have no hospital admissions, that's gone up to 30% of people. For people that want to be at home for the last days of life, we've been able to reduce that as well. So what we found is that despite a general increase in the number of people dying in hospital, we've reduced that by 12%, meaning that people are able to spend those precious last few hours at home with the people that they love and care about.
I think the great positive of IMPaCT is that it supports the patient and carer in a way that we've not been able to before. so that we can provide urgent and appropriate response to whatever their need is, day or night, by the best part of our service. And I don't think we've ever been in a position to do that before. So I think it's a real positive move to see the services working collaboratively and with that one team approach.